Would you know how to identify if someone is suffering from a stroke? Would you know how to act in that situation? First aid in the case of a stroke is crucial so that the person can have a better chance of surviving and with the least possible damage. That's why, in this video, I'm going to definitively show you how to recognize a stroke and what you need to do for first aid. Well, the symptoms of a stroke can vary greatly from person to person as they depend on the area of the brain affected and the severity of the event. However, some of the most common symptoms a person may experience include sudden weakness or numbness. The person may feel weakness or numbness on one side of the body, including the face, arm, and leg. In some cases, the weakness can be so severe that the person may not be able to move or speak. Difficulty speaking or understanding. The person may have difficulty speaking or understanding what others are saying. They may speak the wrong words, have difficulty finding the right words, or have difficulty understanding language. Vision problems. The person may have sudden loss of vision in one or both eyes, or they may have blurred or double vision. Balance problems. The person may have difficulty maintaining balance or may feel dizzy. Headache. The person may have a sudden and intense headache, which may be different from any headache they have ever experienced before. Other symptoms include, the person may also experience other symptoms such as nausea, vomiting, confusion, disorientation, or seizures. It is important to remember that not all people who suffer a stroke will experience all of these symptoms. If you or someone you know experiences any of the above symptoms, it is important to seek immediate medical attention. The faster the stroke is treated, the greater the chances of a full recovery. Some tips to help identify a stroke are: face, ask the person to smile. If one side of the face is drooping, it could be a sign of a stroke. Arms, ask the person to raise both arms. If one arm is lower than the other, it could be a sign of a stroke. Speech, ask the person to repeat a simple phrase. If the person has difficulty speaking or if speech is slurred, it could be a sign of a stroke. Time, if you notice any of these symptoms, it is important to seek immediate medical attention. Now, if you have identified that they have indeed had a stroke, you need to know how to provide assistance to the person who is suffering a stroke. But before we continue, I want to let you know that I've prepared exclusive content for you who want to have better cardiovascular health. Access it now by clicking on the link in the first pinned comment. Call emergency services immediately. Stroke is a medical emergency, and the faster the person receives medical attention, the greater the chances of recovery. Stay calm and reassure the victim. Speak to the person in a calm and reassuring manner. Explain that you are there to help and that an ambulance is on the way. Check if the victim is conscious. If the victim is unconscious, lay them on their side on a hard, flat surface. This will help prevent choking on vomit. Loosen the victim's clothing. This will help facilitate breathing. Monitor the victim's vital signs. If the victim is breathing and has a pulse, continue to monitor them until the ambulance arrives. If the victim is not breathing, start cardiopulmonary resuscitation (CPR). Do not give the victim anything to eat or drink. The victim may have difficulty swallowing and could choke. Keep the victim warm. Cover the victim with a blanket or jacket. Take note of the victim's symptoms. This will help doctors diagnose and treat the stroke. What not to do? Do not give the victim aspirin or other medications. Do not try to move the victim. Do not put anything in the victim's mouth. Do not leave the victim alone. Remember, stroke is a medical emergency. Acting quickly can save the victim's life. Remembering that prevention is always better. So, to prevent stroke, it is crucial and can be achieved through lifestyle changes such as maintaining a healthy diet, exercising regularly, controlling blood pressure, and avoiding smoking. Additionally, it is important to be aware of personal risk factors and undergo regular screenings to detect any underlying conditions that may increase the likelihood of a stroke. In summary, being informed about the warning signs of stroke, acting quickly in the face of them, and adopting preventive measures are essential steps to reduce the risk and consequences of this potentially devastating condition. Like this content? Subscribe now and leave your comment below sharing your experiences and doubts. And if you like this content, leave a like on the video so that YouTube delivers this content to more people who need it. Remember to check out our exclusive content in the link of the first pinned comment if you want to know how to have better cardiovascular health. Okay? Thank you very much and see you soon.